Dr. Vijayakumar, Honorary Nutritional President, IAPEN, India. Actually, he told, in spite of my busy schedule, I came here because the recommendation from the topmost person, that is my husband. So I was unable to deny it because he is allowing me to roam everywhere. So at least one request I have to oblige. So because of that only I am here, because I had a governor address yesterday and the whole week is packed with responsibilities. But anyhow, this is as a doctor, whenever there is a call from the medical conferences, it is my duty, priority to attend this. So I have come here. I am really happy to have a very colorful audience. Dr.Bhuvaneshwari, Chief Organiser, Consultant Anesthesiologist, Surya Hospital. Yeah. Dr. Shivashankar, Dr. Lekha Sridharan, Dr. Rocco Barzoni, and Veerat Dej, Secretary, and all the participants, experts, nutritionists, the media personnel, my security personnel, and all. First of all, you yourself, after RRR, what is left to be mentioned? Because RRR is a hit. So your conference is also a super hit that you can. And I can refresh. After that, I can add another R. That is the reality of the nutrition. Supplement is the reality. So refresh, renew, refocus, that is the reality. And he told after he removed the RE, refresh, new focus. So as nutritionist, you can infuse and you can reduce also. So it is your duty whenever you make it possible. As my husband always says, as a nephrologist, for some patients we advise protein, more protein. For some patients we advise no protein. So the patient will be asking, like the same family, two renal patients will be there. So one will ask them to add protein and another will ask them to prevent protein. So they will ask, we both are suffering from renal disease. You are so partial, you are asking to add and remove. So that is the RE. If you can add also, it will have some effect. If we remove also, that will have an effect. So that is the theme which I very aptly mentioned here. And as a gynecologist, I always felt, because it's not mere words that I wanted to come here. After I became the governor of Telangana, Telangana is with 11% tribal population. And when we went and investigated them about their nutritional facts, aspects, we found only they had 4 gram hemoglobin. And when we prescribed iron tablets, they didn't take it. In another lighter sense, I always used to say, when I was a house surgeon at Tanjore Medical College, to the gynecology patients, to the pregnant patients, when we prescribe iron tablets, they will take it. And in the afternoon, when we go out for our lunch, we used to see the iron tablets thrown in the ground. So we used to pick it up and we used to call the patients and ask, you are suffering from anemia, why are you thrown these tablets in the ground? They used to say, I am already black in color. My mother-in-law is telling you have to give birth to a fair baby. So if you are giving dark tablets, then again my baby will be black in color. So I don't want to take. So I called some of the pharmacists and told, please produce iron tablets in a colorful way. So ladies always like colorful sarees, so tablets also, if it is colorful only, they will take it. So this is all, even though it appears very small thing, these are the things we have to concentrate, that is the part of the nutrition. And I have to say the same during my tenure as house surgeon, the fact, because I have signed an MOU with the National Institute of Nutrition, Hyderabad. Why means we have taken forward the message of nutrition to the tribal people, and when we gave iron tablets, they didn't take it. But Mahua is a flower for addiction they take. So then we found if you do laddus in Mahua, then they will take. So this is the part of the nutritionist. It is not just prescribing to that region, to that population, to the section, how it could be administered and how it could be supported. So that's the role of the nutritionist. So only it is very clear that the medical diagnosis is incomplete without the nutritional diagnosis. And as gynecologists, you have to take good food, nutritional food. So when I had a seminar with the NIL, they were telling all the government, because Vijayakumar also was telling about the government schemes. All the government schemes, the nutritional kits are given after 3 months or 6 months or in the last trimester, but the concentration should be on the pre-conceptional stage. Nowhere it is concentrated. The mother should be provided with adequate nutrition in the pre-conceptional stage. So only Corona alerted us and it taught us these. So we have to respect our roots. For example, during menarche and during the marriage time, in the villages, they give black gram curry and they give jaggery and all they give drumstick soup. These are the nutrition, because we all forgot everything. Talking about nutrition and traditional nutrition we forgot. My request is, because our ancestors are more clever, they planned what is needed for us. And at that time they provided us. But, for example, mother's milk. I want to narrate one incident when I was house surgeon at Honb'le Medical College. One young lady gave birth to twins. So the both twins were 2.5 kg at birth weight. Now constant monitoring is needed for the twins. So next month when she came for follow-up, the girl twin was lower in weight, the male twin gained weight. Then we were asking her. Then we did all the investigations were within normal limits. And suddenly, I asked her, you're a thin-built lady, and she's a village person, and I asked her, are you feeding the children properly? She told me, I'm feeding the children properly. Then we asked whether you have adequate breast milk to feed both the children. The answer shocked me. She told, I am feeding my male child with breast milk and I am feeding my female child with diluted cow's milk. Why means my mother-in-law always say my male child needs strength. Female child doesn't need so much of strength. So these type of beliefs are there. So your responsibility is one, research. Particularly research about the future nutritional aspects. But our tradition had very good things. For example, our Indian thali, our Tamil Nadu, because first we take sambar, full of protein and vegetables. Then we take rasam, which pepper and it's digestive. And then we take curd, which is probiotic. And then we take sweet. So, where we will get such a balanced diet? But now, we are not taking that. That is the tropical, traditional and regional food for respect. But we are jumping to other countries' food. So, we have to introspect ourselves. At the same time, we have to do some researches, particularly during Corona. The immune boosters, particularly our traditional boosters, immune boosters really played a part. And particularly this conference focus on parental nutrition and enteral nutrition. I always say, first enteral nutrition is the best is the mother's milk. And how many of us are practicing that? How many of us are nutritional consultation is there for mothers. There should be consultation. Why a dietitian means immediately for obesity only dietitian. No any other disease. So only you have to start telling them nutritionist, because that is nutrition takes parts in each and every disease. Not only disease, it's a prevention and more healthy. I always used to say, when we take nutrition, there won't be any need for higher treatment at all. When I was addressing Ayurvedic conference, usually in Tamil we say, "Unave marundu marunde unavu." What we take is medicine. And what is medicine is our food. But we lost all these traditions. So when I was telling you have to concentrate on your food, some of our traditional foods are very good. Then one of them stood up and asked, "Oh, you are telling us to take traditional food, and that will prevent the disease. Will it treat the cardiac disease, heart attack?" Then I told, if you are good in your nutrition, there won't be any incidence of heart attack, please. You understand that. So this concentration, you are very rightly said. Nutrition, concentration on nutrition, it is even when diagnosis, the nutritional diagnosis is, when I was a practicing person also, I should confess that we were not taking so much of efforts to alert them on nutrition. So these type of conferences, because we know the medical conferences, the sharing of our knowledge by our national counterparts and from our international counterparts, we can have more knowledge about it. And as doctors, we always know to face the challenges. And as introduced by Dr. Vijayakumar, I am a doctor and I am handling 2 states. When I became the governor of Telangana, the critics came forward and said, youngest governor, how she is going to manage the youngest state? It's a newborn state. You know, Telangana is the newborn state, just 8 years old. Then I told her, as a gynecologist, I can manage newborn babies. So Telangana is a newborn baby, so I can manage. Then when I was given an additional charge as governor of Puducherry, and as a lieutenant governor of Puducherry, same critics came forward and told, okay, she managed the one state, then how she is going to manage another state? Then I told, as gynecologist, if singleton is born, I can manage. If twin babies are born, also I can manage. So doctors act according to the situation, and doctors know to face the challenges. And now the prospects and the vision of the whole medical practice has become very different after COVID. I can say. Post-COVID situation. What is the nutritional status? How nutrition supported our diagnosis, our treatment. So much. Actually, the nutrition subject, the horizon has much widened. Whether it is parenteral, whether it is oral, whether it is any other form, it is really, it has almost changed. So the research activities definitely will help us. And apart from that, the parenteral nutrition, as an administrator also I know, the cost of it should be cost effective. That is very important. When we write medicine for hypertension, nowadays I always laud our Honorable Prime Minister for bringing out the Jan shops. Even the protein powders, the anemia tablets are 30% reduced. Some tablets are 60% reduced in the generic shops. So when we write medicine for hypertension, the patient used to go and tell, when I go to the pharmacy and ask medicine for hypertension, when I hear the cost, my hypertension shooted up, then my disease. And when I go and get the ulcer tablet, the ulcer intensified when I hear the cost of the tablet. When I was practicing, one day I was going on rounds, one patient was sitting very sad, and I told, why are you sitting so sad? Why are you so much depressed? Don't worry, what will happen? Then he told, I am not worried what will happen, doctor. I am worried how much it will cost. That's my worry. ஸோ அதான் தமிழ்ல எப்படி சொல்றேன், நான் என்ன ஆகுமோன்னு கவலைப்படாதுங்க, எவ்வளவு ஆகுமோன்னு தான் கவலையா இருக்கு டாக்டர், என்ன ஆகுமோன்னு எனக்கு கவலைப்படல அப்படின்னு. ஸோ திஸ் ஆல் திங்ஸ், ஸோ ஜஸ்ட் லைக் தட் we are prescribing, we are advising, but whether it is acceptable by the person, we are not in the level playing field. One person can be affluent enough to follow our advice, another person won't be more competent enough to follow our advice. So just like that advice, so we have to concentrate, and focus should be individual focus. So these are all things we have to think it over. And apart from that, cost effectiveness is more important, and this particularly the parental nutrition. And there is a craze for parental nutrition also, because when we in the periphery, if you practice, they used to come and tell, or IV injection போட்டு விட்டுருங்க சரியா போயிடும். They won't enteral advice, they won't ask. So some prick is needed for them. Even injections, they give tablets. No, I won't be all right. ஒரு ஊசி போட்டா சரியா போயிடும். So they want always a prick. So we have to understand the mindset of the people, and it is creating awareness about nutrition is very, very difficult. I have to say, when I was practicing sonology at Tanjore, once when patient, because creating awareness among the public, it is also very important about nutrition. Not only about nutrition, about disease and everything. Once I was asking a patient, you have to come with full urine, tomorrow I have to study your prostate. Next day he came, opened a yellow bag and put one Horlicks bottle of urine, second Horlicks bottle of urine, third Horlicks bottle of urine. Then you only told me, you come with full urine. So why I am telling it, it may sound very simple and humorous, but the awareness, it should be created among the public. Because we are not dealing with the people with same education, same background, same sociology. So individualized concentration is more important, particularly the nutrition aspect. Little affluent people, little educated people are now concentrating, and they consult a nutritionist. But the downtrodden people, even now we see ladies with angular stomatitis. I used to think, even now, WHO, all you know, that says more than 60% of women are anemic. So simple things we are not concentrating. So nutrition is the primary factor to maintain the health of a person, but always it is ignored. So I am very happy you concentrate on that, and a conference is held. Whenever a focus is there, definitely there will be benefits. And particularly Vijayakumar likes that because he is full of RRR, and RRR second also, expecting the second edition of RRR also. So really, it is fantastic experience to share my views with you. And my request is, whatever may be the research by the doctors, whatever may be the focus, it should help the last person suffering. The poorest poor should be helped. And even all the government hospitals also should have good nutrition departments. And as you said, midday meals. Even all the states, even Puducherry has midday meals, and we concentrate on vegetables. Because organization Akshaya Patra, myself and Chief Minister particularly went personally to see how many vegetables every day they add. So more vegetables are given to the children. And even in Telangana, we have organized breakfast for the Rajbhavan school children. And another thing, when I was the president here, state president, I requested the government to give one egg and one banana. Because banana will help the children because it's a fruit, and also it will help the farmers. So, and another thing, this kadala urundai. Small things only. When Anganwadi, when I took charge as Governor and Lieutenant Governor of Puducherry, only one egg was given to the children. Then I went and increased to 3 eggs. That was my first signature the next day. So when we are aware of such situations, So we can alert the administrators, as you said, the midday meals. You can, in this nutrition conference itself, you can pass resolution and submit to the government. So all the chief ministers and governments, and as our Honorable Prime Minister, this national education policy also concentration on nutrition. It should provide breakfast also. So with all these inputs, you can alert the government also. You can pass a resolution and submit to the government, so that government also will be benefited and the children also will be benefited. Thank you very much. A good program. And I see more of women folks here. So for that also my compliments. Thank you.